Hello everyone, I'm Dr. Sandeep Madan. I'm your anatomy teacher, and I welcome all of you guys to my 15 days 15 concept series. Today we are meeting on day 11, and we are here with one more concept. So what is the concept today is to discuss about the ligaments around the ankle and their injuries. Okay, so ankle, when you see from the lateral aspect, the bone here is the fibula, and the components of the lateral ligament of the ankle are named according to the name of the bones. For example, this ligament is connecting the anterior part of the talus with the fibula, so anterior talofibular. This will be calcaneofibular, and behind we have posterior talofibular. But if you rotate, you will get to see the medial aspect where we have the tibia, and the name of the components will be similarly like we have the same arrangement. Posterior tibiotalar, this is tibiocalcaneal, this is connecting with the navicular, so it will be tibionavicular, and this one will be anterior tibiotalar. So these four are not separate ligament, these are the components of one ligament that is called as medial ligament, and another name of the medial ligament is deltoid ligament. Okay, so why we are looking at these components and these ligaments? Because sometimes what happens, we are going somewhere and suddenly the foot gets into sprain, right? Suppose there is a sprain in the inversion. What will happen if there is inversion? Then the stretch will be on the lateral aspect. If the stretch will be on the lateral aspect, the lateral ligament will be torn. Now the lateral ligament itself is made up of components, so will everything will be torn? It will depend, either one component or all may be injured depending upon the severity and depending upon the injury type. Okay, but one thing is for sure, looking at the ankle sprain, that if this is the normal situation, in case of inversion, stretch will be on the lateral aspect. In case of eversion, stretch will be on the medial aspect. Making sense? So we can say one thing, that we have to see in case of these type of injuries, where is the sprain, and then we have to think accordingly that which ligament will be gone. And one hint for you guys, all the medial components will be having the word tibia in them, because all of them are having on the medial side, and the medial bone is tibia. Lateral component will be having the word fibula in them. Okay, that is a hint, please remember. So let us take one question for the practice. So here we can say that this is a lady in question, and here you can see the injury type, and you can focus that the foot is getting inversion, right? The sprain is in the inversion. If the sprain is in the inversion, which side? The stretch will be on the lateral side. Among the lateral side, which word should be there? Lateral side fibula word should be there. So here the word is tibial. Deltoid itself is the medial ligament. Okay, so calcaneofibular ligament will be the answer. So we have understood the concept, we have understood the question, that's okay. But one last point that I would like to include before concluding the today's concept, that usually what is our own common experience whenever we are going somewhere? What type of sprain we like experience? Is it the inversion or eversion? So mostly it is the inversion. So mostly it is the inversion, means most common ligament which will be injured is lateral. Okay, but in the lateral we have three components. Yes, so which one, like which component will be the most commonly involved component? That we can remember, that is ATF. What is ATF? Anterior talofibular. Anterior talofibular. But if you see the ATF, another full form, that is always torn first. Now it is not you can say like always it has to be there, that it has to be torn first, but yes, it will help us remembering that ATF, anterior talofibular, is the most commonly involved ligament. So thank you so much for attending this part. I hope this concept was clear, and we'll meet in the next session with the next concept.